This is an x-ray of the patient's chief complaint area. On this x-ray, I'm looking at the ligament space, and I don't see any problems down there whatsoever. No problems. I don't see an abscess develop down here. However, the patient says, "This tooth hurts, doctor. I can't touch it. I can't put my tongue on it. I can't chew on that side. It's been hurting since last night. It's been giving me problems 2 or 3 weeks ago, and then now, last night, it went berserk." What's your pain on a scale of 1 to 10, ma'am? It's about an 8 when it's really bad last night. Right now, it's about 3 or 4. Okay? So, when someone tells you that they have pain, sensitivity to hot and cold, or they have a dull ache that they can't sleep with, that tells you that they have an infection starting. Why can't I see the abscess here? Because the infection hasn't progressed to the point where it's dissolved this bone. Remember, bone is hard. It takes time for that bacteria to develop so much toxin to dissolve this hard bone. So you won't see that infection ball of pus that you would normally see on someone else's x-rays. So when you see this kind of situation where there's no infection but the patient's giving you those symptoms, that is the cornerstone of why patients come in to get root canals, because something is hurting. Okay? We take an x-ray to confirm that, oh my gosh, you got a bullet in here, or you got a little toothpick in here. We have to confirm what's going on down here. So we combine the patient's symptoms with the x-rays. Now, in order to do this root canal, I have to have this x-ray. Why? Because I need to be able to visualize this root and where I'm trying to clean to. We would measure this root to see how long it is, and that would give us an idea of how deep to clean. Okay? Now, in addition, in our office, we take photos of the teeth before we do it. In this particular case, I chose to take the photo of this tooth after this crown fell off. It fell off as I was trying to do the root canal. Looking at this type of x-ray here, I have no idea that that's going to happen. As a matter of fact, I don't see any decay in here. Why? Because the crown is covering all that decay that we just saw in that last photo. So, Mr. Insurance, you can look at this. "Oh, Dr. Nguyen, why did you do a root canal on the tooth?" Well, the patient was in 8 out of 10 pain. She had cold sensitivity previously, and last night it got so bad that she couldn't sleep. Really, I don't see any decay or any infection on your x-rays. Okay. This was what we found underneath the crown.
And you didn't take the crown off. It fell off, you said?
Correct. But if it did fell off, I would have taken it off at some point and taken a picture as well. All right.